students! Welcome back for an informative session on how to increase your caregiving skills while being a nursing student and the best part, earning some extra money. This is a pretty good deal, don't you think? So without further ado, let's dive into the video. Let's look at the basic responsibilities of a healthcare aide. Healthcare aides assist clients, residents, patients with personal care and help these individuals live a healthy and active life. HCAs work with clients to promote independence. How much do HCAs earn? The minimum wage is Canadian $22 an hour, and then there are shift differentials. That means they receive additional money for working weekends, which usually starts on an evening shift on Fridays and lasts till the beginning of a day shift on Mondays. There is also extra compensation if they work evenings and nights. So, if an HCA works a night shift on a Saturday or Sunday or even Friday, their base wage an hour would be Canadian dollars 25 and 50 per hour. Pretty enticing, right? Where can healthcare aides work? In many settings such as hospitals, nursing homes, supportive living facilities, group homes, and so on. So before we go further into the video, I just want to remind you that only the following nursing students enrolled in nursing programs are eligible to work as an HCA while they are studying. If you are a licensed practical nurse, that is LPN, and you are enrolled in an LPN program, you may apply to the HCA directory after completing the first year of studies in your program. For RN students, the requirement is slightly different, so you'd need to have to complete your second year of your BSN program before you can apply to work as a healthcare aide. So if you're planning on working as a healthcare aide, what do you as a nursing student need to know? You'll definitely need to know the basics of medication administration. Make sure you know your 8 rights of medication administration. The right patient, the right drug, the right time, dose, route, reason, documentation, and of course, the patient has the right to refuse. You will also have to know how to assist individuals with transferring using transfer equipment such as a mechanical lift and transfer belts. Also, with positioning mobility devices such as wheelchairs and walkers. You might have to record input and output, and that involves draining urinary catheters and making note of the amount, the color, and the condition of the urine. Sometimes there are patients with ostomy bags, such as an ileostomy or colostomy, and you would be assisting with emptying the contents in the pouch. There are times that you may need to record everything that a patient eats or drinks, maybe because they are on a restricted diet or fluid restriction. You may come across a client who's presenting with delirium or confusion, which they wouldn't normally. What have we learned as part of the basics of nursing when we come across clients with new onsets of confusion? You got it! Possible urinary tract infection. Therefore, you may be required to collect urine or stool samples for patients who are presenting with abnormal signs and symptoms. As a frontline healthcare worker, your observation skills are very important, as you may need to report behavior changes in patients. Last but not least, for those needing help with eating or drinking, knowing how to properly assist them with feeding would be a necessity. The Healthcare Aide Directory is a board that keeps track of all the practicing HCAs in Alberta. The directory reviews and approves applicants who meet the criteria outlined in the website. Once approved, You as the applicant will be issued a 5-digit registration number to reflect your active status. All healthcare aides or anyone wanting to work as a healthcare aide is required to renew their registration annually. There is no fee to renew at this time, but the board will be changing these rules pretty soon for a 30 Canadian dollar fee in the near future. I would like you to pay very close attention to what I'm about to say, because we're going to be talking about all the steps involved with registering yourself on the HCA Directory portal. On the left, you'll see the infographic that I've taken directly from the directory website outlining the steps for registration and application. But hold on, listen to my advice. The first thing you should do is to gather all your necessary paper documents way before you even begin the computer part of things. You need to have 2 pieces of ID, government-issued ID, of which one of it must have a picture of you. So documents like a driver's license or passport would work just fine. For the second piece of ID, you may use your work permit, student visa, permanent resident card, or birth certificate. Then you will also need an official transcript issued by your school's registrar office. This is a simple task, as many registrar departments will be able to give you a printed copy of your unofficial transcripts immediately. Have these documents uploaded to your computer in advance so that you'll be able to complete your registration on one sitting. Next, go to the Alberta portal to create an account first. I have given you the link to the portal in the description box below. This is a 2-step process. You will first need to sign up or create an account, then wait for the confirmation link to be sent to your email. Once you have activated your account, only then you can actually start the registration process. The one section that you will definitely need to pay attention to is the education stream. Because you are a nursing student, you will have to select the second option where it says, I have healthcare education other than healthcare aide. Please be very careful with this section and always double check that you have selected the right option before you submit the application, because this can cause delays. There is a small one-time application fee of 300 Canadian dollars. Once you've paid the fees and uploaded all the documents that I have mentioned earlier, all you have to do is wait for the approval. You will receive an approval confirmation that would look like this. So students, that is everything you need to know about working as a healthcare aide while you are still in school. If you have any questions or would like some clarification about the steps involved, please reach out to me and I will be happy to answer your questions and guide you through for a successful application. As always, please hit the subscribe button before you leave so that you will not miss any new learning opportunities. Wishing you all the best and signing off as the Teaching DOC.